In his close to 10 years with Health City Cayman Islands, the Health City brand and its strategic indicators have grown leaps and bounds, as well as the overall reputation of that institution. Health City is now synonymous with quality and compassion, which is in no small part due to our next speaker. He's a strong believer in assessment, quality, and continuous improvement, and takes every opportunity to lead by example and promote the personal and professional development of his team members. So who better to present on this next topic, which is the changing healthcare landscape in the Cayman Islands, other than Health City's Chief Business Officer, Shomari Scott.
Hello, good night, ladies and gentlemen. Now, I know if Ben had found a Porsche, he wouldn't have been telling anybody about who doesn't have their keys, come and get it, but that's okay. Just to state that, I have a little bit of a bone to pick in that this conference always starts in the evening, and anytime I am given the task to come up here and speak, I have the decision. Do I eat before I come and maybe a little bit lethargic, or do I wait until after I speak and risk the fact that these microphones are very loud and a grumbling stomach may be heard? So I did not eat. So if you hear any noises, please forgive me. And the only reason I say that is because I came up here and I gave that story, and I took out one of the sweets on the table and I ate the sweet thinking that I would be forgiven. And our chief medical officer says, "Do you know how much sugar is in that?" I actually didn't know how much sugar was in it, and he ruined it for me as I took my last bite before I swallowed it, and I was actually planning on having 3 more. But after that comment, I said, you know what? Let me just hold my hunger until after the presentation. Now, this is a fancy, so it's the big green button that looks like it's going forward. Okay, there we go. All right. So my task tonight, after speaking last year, I thought they wouldn't invite me back, but they did. And then last year, Dr. Jefferson tried to show me up by having slides, and I didn't have any slides, so I came here today prepared with slides, and sure enough, my good friend, the CNO, has videos, and I have no videos, so I thought I had, took a step up, but I guess you'll have to invite me next year and I'll have videos. Should probably have virtual reality then, but that's okay. Holograms, that would be even better, so I wouldn't have to do this again. All right, so I just have to ask because, I'm non-compliant, and Dr. Sukian can tell you that as my longtime family physician, and I ate another one of these candies, so once again, not listening to Dr. Gent when he came up, and I was very non-compliant. And right before this presentation, and before we were going to start, I told Sir MC, by the way, you see the 5 minutes that I was supposed to speak? I'm not going to speak, so put that to the back end and give me 15 minutes from my presentation. So they didn't actually ask me to do that. I was being non-compliant again and asked for the 15 minutes. I notice on this clock here, it says 56 minutes, and it's counting down. So I'm just asking, do I have 56 minutes? Nobody says 56. But okay, 15? All right, I get 15 minutes starting now. So when I was thinking about the landscape as it comes to healthcare in the Cayman Islands, it took me to thinking about how the landscape in the Cayman Islands has changed over the years. And you will see the island that time once forgot, to where we are now from a development perspective. And I was wondering how I could potentially use that same concept to figure out where we'll be in the future in the changing landscape as it pertains to healthcare. And I recall a good friend of mine, and I know the audience, a lot of you may, if you're not from here, you may not know Mr. Billy Adam. A good friend of mine, Mr. Billy Adam, used to come see me when I was a young buck in tourism many, many years ago. And he actually used to show me pictures such as this. And he used to say, Shomari, look at all the great things Cayman has done. We've come from here, and we've gone from here to here. And we have all of this great development. But what he used to say to me is, who are we developing for? And I would always think about that. And he said, so we have all these advancements, but who are we developing for? And mark my words, Shomari, in 30 years, indigenous Caymanians will be on a reservation in Cayman, and you'll have to go and see them there because we're not developing for our Caymanians. And that's what Mr. Billy used to say to me. And it resonated to me as I started to think about this presentation, because Dr. Gent touched on it. I keep saying Fifi, sorry. Chief Nursing Officer touched on it as well as the Minister of Health, in regard to the changing landscape of healthcare, but yet we're leaving people behind. So what is all of the good that we're doing if there's a large enough portion of the people who we are supposed to be either developing for and or from a healthcare perspective providing for that are left behind? And even in studying the topic, it was talking about the fact that we as a healthcare industry are shifting from provider-centric care to patient-centric care, meaning we're giving greater access, we're going to the patient, we're listening to the patient more versus the doctor telling you what you should do, even though that's what Dr. Suki used to always do, until she one day, was it 5 years ago, she had a couch in her office, and it wasn't a desk. And she would sit next to me and ask me, okay, Shomari, here are the issues. Now, how are we going to solve this together? And years later, I'm like, oh, that was that patient-centric care coming through. So at the end of the day, regardless what we do, we need to keep the patient at the center of everything we do with all of the solutions that we have. And I promise, I looked at Dr. Gent's notes before he came up here, just to think if there was anything that was going to stand out to me. And sure enough, he was speaking about a lot of the points that I would have made. I promise you, Dr. Gent, I did not copy. But when you're looking at the world's best hospitals, and you look at well-developed medical systems, you see technology, you see the best doctors, you see the best care, but if you can't give access to everybody, who are you developing that health care? Who are you getting that technology? Who is all of that research for? And I delved a little bit further to understand that even in some of the most developed countries with the best healthcare that we always look towards, we need to model after that. When you look at personal bankruptcies, by far, healthcare-related issues, bills, and the such, is the #1 cause of personal bankruptcy. So how can the healthcare system that has all of the accolades and all of the quality truly be impactful if the majority of their citizens that go bankrupt is because of the same solution that we boast we have? The WHO says that 400 million people across the world lack general medical access if they need. In the USA, $4.3 trillion worth of healthcare expenditure is where they're at, and this was a few years ago, so it's probably grown since then. And once again, with all of those issues, we would say, well, those are large countries, those are the issues for the US and other countries. But sure enough, if you look right here in the Cayman Islands, articles from 2021, 2023, 2024, spiraling costs, Healthcare budget for indigent unlikely to cover costs. Healthcare bill still soaring with no plan in sight. And these articles aren't just from now. There would have been many articles over the years past that would have been saying the same exact things, maybe in a different way. So it's not doom and gloom. And before I got up here, the CMO nudged me and said, please add some levity and some light and don't be doom and gloom. But I already had those slides, so I had to show it. That the great thing, however, about the Cayman Islands is that, does anybody know what that train is? No? Can anybody tell me what that train represents? You got to shout it out. Yes. I can, the little engine that could. All right, see? That's great. We got a star pupil at the back. I will increase our healthcare budget by telling the ministry that you need to give that gentleman a prize. And that's Dr. Shaker. You see my eyes, Dr. Shaker, are bad because all these years I'm still fighting against getting a higher prescription for my contacts. So I apologize that I didn't see that was you in the back, but number one student as always. The little train that could. So I have a 6-year-old, so you can understand that these references are embedded in my mind. And the reason it's there is because we, as the Cayman Islands, we are the little islands that could. Against all odds, for no reason that people can really pinpoint, we've been successful. And we've been overtly successful. And I think we're successful because we're smart enough to have the capabilities and to surround ourselves by the capabilities in order to be innovative. And we're also small enough that decisions that we make can have seismic impacts across our island and islands. Now, the little island that could, we're top-notch from a tourism perspective, which you get that with beautiful beaches. Top-notch from a culinary perspective. We coined the phrase first, the culinary capital of the Caribbean, and that means it's true. Most restaurants per capita in the world. And we also have a buoyant financial services industry, being a small country, one of the best financial services industries in the world. And now, from a healthcare perspective, in the Caribbean, only island and country that would have 2 facilities, both private and public, that are Joint Commission International accredited. So I think that deserves a big round of applause. In that we have pillars, and healthcare now will and is becoming one of those pillars that we can brag to the world. We've had articles about the private sector as well in regard to a business model that's innovative and that was allowed to innovate to try and help us to reduce costs, but we have so much further to actually go. And as I was thinking about, the secret sauce that we have here as the Cayman Islands, I was saying, what makes us so special? We have tourism, we have finance, we have healthcare, we have innovation, a melting pot, 120 or 140? 140 different nationalities, all mixed in one. And the number one nationality of all, obviously, being those lovely Caymanians. And what makes us Cayman, and what makes us special? And I started thinking. And, before the advent of CCTV, we had the best security system any island could ever have, in that I remember going to my grandmother's house, and she could tell me who came down. She lived in Northward, and if you know Northward is pretty large. She could tell me who was visiting who at the prison way on the other side. She could tell me, who was having an adulterous affair down the road and which car and who it was and what time the person came, what time the person left. And she could tell me what was happening from the BRAC to her house and back. So I know that special place with the secret sauce. We have CCTV before there was CCTV. We also have a moral compass. I will always remember when I was growing up, they would say, if you're going to do something, what would your grandmother think? Or if she was here, would she approve of what you're doing? And I have many conversations now with people that say, I'm not doing that. You want me end up on Mara Road or what? So we have a moral compass that is other than Jesus. How many persons who are resident here and or Caymanians in the room? Raise your hands. Okay. How many of you have a senior government official or a politician's cell phone in your phone? Raise your hands. All right. I don't know. We're probably the only island that everybody who was from here answered that question with yes. And also, I think we are the only place where, I can take my child to go to pickleball and you would never guess who was on that court, albeit taking more time than they should. When I went to pickleball. Can you guess? It wasn't the CMO. It was somebody a little bit more distinguished than him. It was the governor. It was the governor who was, you have a time, and we reached there 2 minutes early, 2 minutes to 5, and we waited for 5 minutes because I recognized who it was, and I didn't want to kick her off the court. And she wasn't coming off the court, but granted, her back was to me, so it was the other people who were being rude. And sure enough, we went in, and the governor was there with 3 or 4 people, and she surely was kicking butt too, so I must give her that. And my youngest, 6, said to her, can I borrow your racket? And she's like, yes, you may. So I think Cayman is the only place where you can go to pickleball, and the governor of the country will give a 6-year-old her racket for him to actually play with. And then after we played and we got home, my youngest said to my wife, guess who I met? And she's like, who? And he was like, the Queen. And my wife was like, you met the Queen? No, sorry, Bobo, I don't think you met the Queen. And I said, no, you met the governor. And he was like, oh, because I was about to say that she was lying, because I know you're the Queen. And the reason he knows she is the Queen is because she was Miss Cayman 2003, and she has a picture with a crown, and having 2 older siblings convinced him that our mother is the Queen of Cayman. So he was a little bit confused how this lady was lying to him. But I only say that to say, only in Cayman are you able to be small enough that you have all of these unique factors that, it makes it a little bit quirky, but is also the power we have, because at every turn and every corner, there are influential people, and they rub shoulders with everyone, and they understand the issues of the common man, and it's because of that why they care even more deeply than others that may see it on a stat sheet. And that's the secret sauce that allows us to innovate, knowing that we want to make those changes. And they had told me this would play, but it didn't. So can you play the video, please? I have one video. All right. And you see the walk back? So that was Isaiah, and that was after he got the Queen's racket, and he was showing his older brother all of the power he had because he had the Queen's racket. Now, I see I have 3 minutes, but it's going to take a little bit longer, so you're going to have to pull me off the stage. But where are we going? So this, once again, understanding of the landscape of where we are now, understanding that the cost in and of itself and access is an issue not only here, but across the globe. As we look at where we need to go, we need to keep that at the back of our minds, that regardless what we do, and when the robots come and take over, we need to make sure that they take over and everybody has access. So we're actually going where we were back in 2020. We were talking about telemedicine for years, and then COVID made sure that it brought it to the forefront. And I think because of COVID, and obviously we needed to catch up as well because insurance didn't cover it, and there had to be some rules and changes in order to make sure that the healthcare across the Cayman Islands allowed for telemedicine, but that's part of that being able to be nimble. But with the advent of technology and telemedicine, now it's easier, even though I still have to go and, go online for my father and book his appointments overseas as well as locally. He still understands now that technology is where it's at, and he'll call me to come help him, walk him through, and teach him the technology. So telemedicine means we should be able to get wider and further and to stop patients from having to come and increase costs by coming to the hospital, by dealing with them in their houses. Wearable monitoring. I have on an Apple Watch. My son, I didn't even know what he has on, something called WOMP, where it measures everything he's doing throughout the day. And now he goes on the computer at night and he's able to tell me what he ate, what impacted him, how he's running faster, how much sleep he got. And it just reminds us that the future is having this technology that will be on our bodies. It will be within our clothing, right? So it would allow medical professionals to actually monitor all of our vitals and the different movements up and down in regards to a patient's vitals. They can tell whether something is happening, and you no longer have to have, those non-compliant patients like Mr. Shomari Scott, who Dr. Sukian has to call constantly month after month and sees me at a cocktail, pulls me by the ear and says, "You will come and see me tomorrow. I have a slot at 8 a.m. to get me into the office." In the future, you will be able to have all of this monitoring done remotely, and two things happen. You catch the disease profiles and the incidents earlier to Dr. Jensen. If you treat it earlier, there's less cost involved, as well as you're going to be able to monitor remotely, so that will stop non-compliance as well. Now, from a predictive perspective with AI, the one thing that I always found a little bit disconcerting when I started to get involved in healthcare is the fact that we would always look to see who are the most experienced doctors, to see, how many surgeries they've done, how many patients they've seen, and obviously speak to people who would have had interactions, as well as look at all of the case studies, because those doctors that practiced more typically would have gotten better over time. And the fact that we have technology and AI, it's not to replace the physician, but it's actually to enhance everything that they're doing. It's to make sure that they don't have to go into the depths of their memory and to recall all of the cases that they have. At the tip of their fingertips, they can make sure that the same diagnosis that they think is correct, as well as a less experienced physician will be able to have the same access. So in two different verticals, you can be getting the same care, not regardless of the physician, but get it a little bit closer together. And I liken it to taking travel. If you go to the airport or you're booking travel, you don't actually research the pilot, do you? To see whether or not you're going to get there, right? And that's how I liken it to prior to technology. We're researching the doctor to make sure that's the right doctor for us. But yet we're at a point where you don't research the pilot. You just know that with technology and with their training, that pilot, 99.99999% of the time, is going to get you where you need to go, regardless which pilot you get on that plane with. And that's where we need to get to in medicine, and that's where technology is getting us to as well. Just to mention that there is a new test case for a smart toilet seat. So as much as we may have the wearables that I don't wear all the time, as much as we're going to have the wearables in the clothes that you may not wear all the time, they now have a smart toilet seat, which, guess what? As I know it's dinner time, but everybody uses the toilet, right? They have a smart toilet seat that actually monitors your heart rate. It monitors various components. Yeah, it does. And it feeds it back to not what's happening in the bathroom, but all of the vitals. It feeds it back to a remote system. So you can actually tell, especially with elderly patients. So now, the same way electricity more or less is everywhere, Wi-Fi more or less will be everywhere in the future as well. So in your house, using the restroom, if you're not using it enough, it will also alert. If you're using it too much, it will also alert. And it has the vital monitors that goes back to a system so that in real time, you can monitor patients' health, not only in the city, but in rural areas as well. And that was just a picture of, Ben, I'm not looking at your paper, so, you know, because, oh, okay, I'll look at the paper now. Just know this is Ben's fault. I thought, you know, there was a big, bright red telling me wrap up, wrap up, wrap up, and I thought he was handing me something that says wrap up, which is why I wasn't paying any attention. It actually says, you have time, do not rush. So, as I was saying, you know, being non-compliant as usual, Dr. Gent needed to review these presentations 2 weeks in advance. And I sent it at the last moment, and because I sent it at the last moment, some of these slides are out of whack. So this is my airplane slide that was bringing home the point that we don't research the pilot to make sure we reach there in the future. We shouldn't have to research the physician to make sure we're getting the same exact care within a certain percentage point between two physicians, regardless where they are with the advent of technology. All right, so I call it where technology meets compassion, because at the end of the day, once again, Mr. Billy Adam, all those years ago, Shomari, all of these advancements, all this great job you have here with tourism, who are we developing for? So all of this technology that we're talking about, who are we developing for if a large portion of the society can't gain access, or even if they can gain access, they're scared about the unknown costs, and therefore it just takes any reason for a gentleman to not go to the hospital, to think that he may not know the cost is just the final point where he's like, no, I'll leave it till later. When I was thinking about the ecosystem, and my mother being the teacher, make sure you define it before you describe it, interdependent networks of organizations and sectors within a community that work collectively to provide care. And that's what an ecosystem is. And Shomari being Shomari, oh, I'm getting old. I'm speaking in the third person. Yeah. So, me being me, I will course correct. I'm sounding like my father. I don't want to do that. I looked at the definition and said, you know what? How does this relate to Cayman? And can anybody tell me with all those ingredients what we're doing? Don't make Dr. Shaker have to answer again. We must have some chefs in the room. Cake, there we go. Thank you. And believe it or not, when I said, you know what? I've seen a cake being baked and there are a lot of ingredients, and if you miss just one, that cake is horrible, right? I actually had to, you know, Google and then call my mother and said, what are the ingredients that go in a cake, mommy? In order to be able to get this slide. But I thought about the fact that an ecosystem is interdependent, and you need private providers, public providers, obviously the medical professionals, the technology as well as the payment mechanisms in order to make that cake whole and in order to make it taste right. So from a primary care physician perspective, I thought about it and I saw primary care, Dr. Gent, as the actual eggs. And these are the eggs that keep everything in the cake together, because these are the eggs that identify the problem early and will walk through each process with the patient, regardless if the patient leaves their network or not, to make sure at the final end that that cake and that patient has gotten everything they needed to get. So the primary care physician, as well as those services, are the egg that binds that cake together. The technology is the sugar. It's the sweetener. That cake is whole, but it's not going to be as good unless you have the actual technology. Yes, with the cake being whole, it will do its job, but with that technology that helps to enhance what the physicians are doing in order to make sure that that cake is as sweet as possible. From an insurance perspective, you have the richness and the moisture throughout the cake to make sure that all of those ingredients also come together, and because without insurance, without your payment mechanisms, then that means that cake will not be whole. And that comes to government funding as well. So the government funding is that baking soda, right? That leavener that brings that cake, right? So it takes those that are less fortunate within this society and make sure that cake rises so all of the ingredients and everybody within that cake gains access, and that's what we need to continue to have a look at as well. And then, compassion. Obviously, everything that we're doing, you sprinkle that compassion on top to make sure that that cake is going to be as best as ever. However, if you have all of those ingredients and you were to taste those ingredients each by themselves in front of you, does it taste good? Separately? Not a trick question. Only the sugar? Yeah, never tried that before. I've never done that, Dr. Jen. I have never tried the sugar without all of the other components. But we have to mix it together. So it's the collaboration throughout the entire system, private care, secondary, tertiary, government, payment mechanisms, compassion, knowledge, systems, that you mix that all together to make sure that it is level. And then you have to bake it. So the government, through their policy and regulation, needs to make sure that the atmosphere is correct and the atmosphere is just at the right level so that all of those ingredients can actually rise to the occasion and become one. From a quality assurance perspective, you need to make sure that you have your patient feedback, you have your quality indicators, the government has the quality indicators, and you're always paying attention to it. So it's like that baker that's looking to make sure that that cake doesn't get burnt or that you don't take it out too early. And then the frosting at the end is the patient experience, because at the end of the day, the patient has to be at the center of all we do, because if not, then who are we developing for? And even though I was going to show, the frosting, I love Salt Bae. People, my wife hates to carry me to a steakhouse because I do the Salt Bae, and I found that and I was like, yeah, that's even better. Salt Bae, putting the actual frosting on it as well. And at the end, with all of those ingredients going through the process that we said, that's the perfect healthcare ecosystem. If you have too much of one without enough of the other, the cake is going to be off. It's not going to taste right. It'll be too salty, too sweet. It won't rise. And that's why, regardless what's here, keep the patient at the center, understand the cost is an issue that is going to outstrip, in the future, more and more individuals from being able to gain access, because at the end of the day, we need harmonious perfection so that that cake can be eaten by the patients and not by the more wealthy patients, but every patient within our society. And I will end, yes, I'm ending, Ben, by just stating that a lot of times, if you care, and because so many people touch you, like I was mentioning with decision makers, at times we want to put 10 pots on the stove at once, and we want our hands in all pots. As policymakers and as decision makers for the country, sometimes you set the temperature, you set the policy, you step back and allow innovation to happen and allow the sector to rise, and you will get the best perfection you could ever estimate. So, everyone knows that gentleman, right? So instead of being the cook, because I don't see him cooking, actually be the taste taker at the back end that gives the rules, sits back, and then has the meals prepared, and then you can actually say, yes, this is perfect. Now go forth and make those meals for everyone. So I end by saying the secret sauce is that we're small enough to make major impacts. We're smart enough to have all of the capabilities to be innovative. But the last S is, are we strong enough and brave enough to make the tough, hard decisions that will actually lead to the vision and the outputs and outcomes that we want? And I leave there because another thing unique about the Cayman Islands is that we have our resident chickens. And I have my sons, they took 2 chicks from time they were Savannah chicks, Miss Heather. They were actually Savannah chicks that they took from their grandmother's house and brought them all the way in Georgetown and raised them. And there is 1 chicken now. And one was yellow, one was black, so Sunshine and Midnight. And they're older now. And we have a chicken pen in the backyard that my father built for them. And there is one, my son leaves the gate open every day, and they wander around, run away from colors, and they come back in the night. And sometimes Matthias locks the gate and leaves Sunshine inside, but Midnight is the skittle. She's just like, she's the one that's just always roaming the street, and then, we're trying to go to sleep, and then we hear knocking on the front door. And every time, it's always Midnight looking like that, saying, you need to open the gate to the kitchen pen to let me back in. So more times than not, I have to let that chicken back in. But she's always looking at me with this disapproving look. And this is the disapproving look I have, knowing that we as a healthcare industry, and I hate to say it, and I know you wanted me to end on a light note, but we have failed over the past 20 years. The fact that they always say you can't manage what you don't measure. So it's great that this minister has come in with the team that she has, that is actually giving us the data now, that we can actually measure and monitor what's happening. However, there were different indications over probably the past 20 years that told us we would be where we are today. And we haven't made the tough, strong, hard decisions to get us on the right path, making sure that we have a healthier population, but that we also have access for all. Because even though on paper we talk about, we have 98% insurance coverage, more and more people are creeping into those lower levels of insurance that the preventative care, as Dr. Gent says, is lesser. So when they have a catastrophic event, that's covered. But the actual preventative care, they run out of very quickly. And I found that out having helpers previously that would have issues, and realized that they go for 1 test, and the next test is out of pocket, and how are they going to afford that? So obviously, we chip in and pay, and that's when you really start to understand, what about all those other individuals within our society that may not have an employer that would have paid and said, no, you go regardless, we're going to take care of it. So that isn't on the government, that isn't on the individual, that's on all of us in this room. However, once again, we're small enough that we can make an impact. So if we all get together, we have the right plans, and we make those hard decisions that we in the private sector will complain about it, but we make those hard decisions, then we all can make sure that this conference that happens 5 years from now, all those indicators are on the right side, and many more people have access. Thank you, and God bless.